16.
Ocala's information station, 1370 WOCA.
Ocala.
I always think it's cool when the host is on camera walking into the studio, shaking Joe's hand. Dr. Riad Fakhouri is here. He's here to answer the questions that you have about your health. If it's in your body, then it's something he deals with. How about that? All the way from the top of your head to the tip of your toe, and that's why it's called the Head to Toe Care Show. Dr. Riad Fakhouri is a chiropractic orthopedist, and he's the owner of Fakhouri Medical and Chiropractic Center right here in Ocala at 1009 Southwest 16th Lane. And the phone number over at his office is 352-351-3413. But right now you can speak to Dr. Fakhouri on the air and ask a question if you've got something hurting you. And the phone number is the WOCA Climate Control Source Hotline, 622-9622, and the area code is 352 if you're out of the area. Good morning, Doctor.
Good morning, Larry. Well, you know, Larry, between the front door and the studio is Dan, and we had to stop and talk a little bit about flying, so that's why I got a little delayed sitting in the chair over here.
Flying is your passion? Is it a new passion for you?
It's a nice sport. It's a new sport, yes.
Yeah. Does it in order to use that as a segue into what we normally talk about, does it give challenging? Does it challenge your body at all in doing something like that?
Oh, you better believe it. We should call Dan and have him talk a little bit about this also. But you just have to rearrange your thoughts and the way you work and the controls. You don't drive it like a car. It's another environment.
And a word I actually learned from you, the word ergonomics,
right,
must come into play when you're in a new kind of a thing you have to control, and it's a different environment, right? You got to kind of position yourself and make sure that you've got it so that it's comfortable for you.
Just like getting into a new car, you have to know where everything is, all the controls, all the buttons. That's correct, and that's the terminology. Ergonomics is basically how your body works with the environment around you, whether it's your workstation, whether it's a vehicle, whether it's a bulldozer, whatever it might be.
Have you ever heard this? And I'm asking a question I probably know that you have, but if you're asleep in a car that's in an accident, you may not get as injured as the person who's awake and sees it coming. Have you ever heard that?
You know, that's really interesting because it can be. There's just so many variables. It may not be. For example, some people will recline the seat back when they sleep, and so their seatbelt doesn't restrain them properly, so they will, if there's an impact, they'll be moved forward. That's right. And sometimes they'll slip through. That's right. And so the shoulder harness may not restrain them properly. Sometimes the head will be off to the side if you sleep. And anytime your head is not positioned straight forward, then you have a greater chance of injury. And a little way that I let the listeners understand that if you're looking straight ahead and you put your head forward and backwards, you have good motion. But turn your head to the left a little bit and now go forward and backwards, and you'll see that your motion is much more restricted. So that's why quite often on the history, when somebody comes in after an accident, we like to know, were they looking straight ahead, to the left, to the right? Sometimes mothers will be looking at the children to the right on impact. Other times people might be sleeping and their head shifted. Strange things happen. Sometimes you have people reaching in the back at the same time. I mean, we've had so many different circumstances within the vehicle upon an impact, and that causes different forces on the body, so we have to address those differently, because if your head is rotated and you have an impact from behind, you have more chance of having a fracture or trauma to the bone. So that's why we take special x-rays at the Fakhouri Medical and Chiropractic Center, which are called obliques. And we also take a flexion and extension, which is a forward motion and backwards, so we can see how the neck is working, looking for any minute injuries to the bone that have to be addressed and taken care of.
Well, when you bring up x-rays, and typically I think of x-rays as being a device or a tool to examine the bone, the skeletals, of whatever, the bones. Is there such a device to look at the muscles and the nerves that you also work with?
Well, we do have a physiatrist in the office. When somebody has an injury to a nerve, let's say that they have a disc herniation and the herniated disc is putting pressure on the nerve, has damaged the nerve, then there's testing called the EMG NCV testing. And the electromyogram testing, what it does, it helps us to be able to generate a current in that muscle and nerve unit to see if it's working properly or not. And the computer can evaluate if there's any latency or delay in that process.
Really?
And then that helps us to know if it's an acute injury to the nerve, which means if it's happened recently. If it's a chronic injury to the nerve, did it happen at a later point? And so it could give us a lot of information.
So our nervous system is really a network of wiring, isn't it?
It really is. It is, and it's a very complex one. Everything is going to the brain and away from the brain. So that spinal cord is the conduit of sending out nerves to all parts of the body and bringing information back to the brain, so the brain is getting feedback on what's happening.
Isn't that amazing?
It really is amazing.
I mean, it really. And so I'm guessing the battery of that electrical system is the brain itself.
Well, the brain, like we have the heart that pumps the fluid around the blood, the brain is sort of the heart of the nervous system.
And when something hurts, and you've explained this before too, the brain is what feels it, but you sense it where you're supposed to sense it.
Correct.
Even though the brain is kind of like with seeing, you don't really see with your eyes, you see with your brain.
Right, and there's different sense receptors in the body. There's the ones that are superficial on the skin, which give you the very sharp and very acute sensation and a very quick sensation. And then you have the deeper ones, which are in the organs and the deeper tissues, which are more of a dull, achy discomfort. So when somebody comes in and they're saying that I'm feeling a dull, achy pain into my arm, then we know which nerve receptors are being irritated, and by their motion, by the location of the pain, we can pretty much determine which nerve is being pinched also. And
we do have I thought we had a phone call. We do have a phone line open. I guess I could say it that way. The WOCA Climate Control Source hotline is 352 if you're out of the area. And then 622-9622 if you would like to speak to Dr. Fakhouri. Maybe something's going on in your body, maybe somebody else's body. And, we're coming up on a very busy traveling weekend.
Yes.
Just be careful out there, and if you happen to be involved in something, don't wait. Remember, is that 14-day thing in effect?
Yes. And
don't wait.
And it's sort of, the only blessing behind that 14-day law is that people will react and come in. They'll have some stiffness, they'll have some soreness. They won't delay, but they'll come in and get it taken care of.
All right, let's go to the phone. Good morning. You're on the air with Dr. Fakhouri.
Yes, good morning, doctor.
Hey, good morning.
At your office with a patient, are you capable of diagnosing early stage MS?
Yes, sir. Yes, sir.
Okay, yeah, which is a very serious situation, but it can be detected early enough at that point.
It can be, and we have some tools. One is the diagnosticians in the office, Dr. Shanawani, our medical doctor, Dr. Teeter, Dr. Joe Hutchison, Dr. Carol Kim. We are trained because the MS is a neurological disorder,
right?
And it manifests itself. But you have to look carefully. You have to look. There's things that deal with balance, vision. There's different clues that you look that you start realizing that a person may be having some difficulty and early stages of MS. And then at that point, we can order an MRI of the brain. And when the diagnostic test and the telltale sign of MS is plaquing on the brain, that's seen through the MRI study.
Okay. Is that more of like a young adult disease than anything else?
It can vary. Usually you'll get the young middle age, but it could show up later in life also. And it can go into remission also.
Okay. Would a person that's diagnosed with it and that be able to get complete treatment from your field?
We can help. Again, MS is a very difficult type of disorder to treat. So we cannot. It's almost like a rheumatoid arthritis. You can treat the symptoms, but you really are not able to get rid of it. You hope it goes into remission, and sort of just goes away and stays dormant. But we can help with the symptomatology and with the resultant problems that a person has from MS.
Okay, fine. All right, thank you. Have a nice Thanksgiving, and thank you for your answer.
And happy Thanksgiving to you also, to your family.
You bet. Bye now.
Thank you. So there are some things, Larry, that we can take care of, and there's some things that we can't. And then there's some things that we can't eliminate, but we can make people more comfortable. So in scenarios where people come in with chronic conditions at the Fukuri Medical and Chiropractic Center, let's say they were in an accident and they wait 2-3 years and they finally come in. That's called chronic. That means it's been there for a long time. We can help a good 90-95% of those people out of the pain, but because it is a chronic situation, they have to come in every now and then to remind the body where it should be, almost like a wellness care or maintenance care. If we can catch the problem early on, like in the first couple of weeks, before the scar tissue starts to heal and before the memory of the body gets used to that pattern, we at that point can do more and help that person so they have less residual problems in the future.
And that's a message that we need to hear. If you've been living with a pain for a long time, there's still hope.
Oh, yes.
It's not always undoable.
And often we hear people saying, well, I just need to learn to live with the pain the rest of my life.
Yeah, you hear that a lot.
And they come in, they feel better. Excuse me. You have to excuse my throat today.
Okay, all right.
But they come in, they feel better from the first or second visit, and then there's that hope that, no, I don't have to live with this the rest of my life. I don't have to be in pain all the time. And coming in once or twice a month to keep them pain-free is a small price to pay to keep their level of health much higher. And we've heard that, when somebody goes to a chiropractor, what some of the myths are, well, once you go to a chiropractor, you have to go forever. You've heard that probably. And so the reason being that most people that come in, they wait too long. They wait until there's damage. So when we do an adjustment, within 3, 4, 5, 6 adjustments, that person is pain-free. But but the structure is weak. So the problem is, it'll start going back into its old patterns because it's been used to that for 2, 3, 4, 5 years.
Right.
So we have to every now and then remind it where it should go. So as it starts to slip out, maybe every once a month, to put it back into position. If we don't do that, the problem reoccurs again. And that's why we stress, you and I, the 3-day rule, getting in right away, because if we can get it early, before the body gets into a pattern, treat it, get it to heal, get it to resolve, then we're usually finished with it, and we don't need to see that person unless, God forbid, there's another trauma or something should happen to them.
By the way, on Saturday was Light Up Ocala. We had a booth, WOCA had a booth there. You don't know how many people came up to me and said, "Are you the guy that talks to my doctor?" And I said, "Yeah, I'm the guy." Yeah, so you had a lot of people out there who watch and or listen to you and know that you're here, and they kind of put 2 and 2 together when they saw us at the
We should stop and just say what a wonderful community we're in. Marion County, Ocala, it's the best. You still feel like you're in a small town.
Oh yeah,
it's beautiful because we're all interconnected and interrelated together.
Oh yeah, and the beautiful thing about meeting the actual people that listen, you don't feel like there's this divide between us and them. This is no different than, I guess, a bakery. We instead of selling cakes, we sell sound. So
right. And it's nice to connect with those people that you serve.
Yeah. When somebody has a pain that has been the pain that they decided to live with, that they had no choice but to live with, I'm just wondering what it's like from your perspective to actually be able to tell them, no, you don't have to live with it.
Yes, it's two-sided. Let's talk about fibromyalgia, and many of the ladies that are listening know what fibromyalgia is. It's a chronic, vague, achy pain throughout the body, usually associated with fatigue, chronic fatigue syndrome, and usually what's interesting, quite often it happens from a trauma and then it occurs from a trauma and later on shows up as fibromyalgia. And I feel that there's a direct correlation from trauma and injury to the muscles, causing scarring, causing fibrous tissue, and then at a later point showing up as fibromyalgia, fibrous muscles.
That's interesting. I've never heard anybody make that connection before.
And again, this is why it's so important to get in early. You're working in the yard, you pick a bag up, you hurt your shoulder, you feel tightness in the top and the trap. If you leave it, it just won't go away on its own. If it continues past 3 days, let's take care of it, because when it becomes chronic, then that muscle, that scar tissue in the muscle, it grows as time goes on. It grows, and then your nerves become hypersensitive around that scar tissue, and so any movement of the scar will cause an overabundance of messages going from the nerve to the spinal cord to the brain, and the brain will perceive a problem in there. It won't know how to translate that problem, but it knows there's a problem, so it sends a message down from the spinal cord to the nerves, to the muscles around that area to tighten up and protect the area. And so now you have spasms and you have pain and you have stiffness, and then you stop moving that area, and so then you start getting adhesions. So it becomes a cycle, a chronic cycle that way. And so when people come to the Fukuri Medical and Chiropractic Center with fibromyalgia, we tell them directly, because we have to be very upfront, we're not going to get rid of the fibromyalgia. We can't eliminate it.
You cannot. Okay.
Cannot. However, we can most likely help you to feel better, bring elasticity to the muscles, reduce the pain, reduce the number of flare-ups, and when you do have a flare-up, it won't be as severe or as long-lasting. And that in itself is tremendous, because if you can give a person 1 day of relief, it's incredible if they're in pain every single day.
Yeah, I would imagine so. Yeah, I've never heard anybody make that connection. That might actually be good news, because if you can make a connection to what caused it, then as you just implied, you can prevent it.
Correct, exactly. And the name of the game is prevention, and the best way to prevent it, early diagnosis, early treatment, and not only early treatment, but very aggressive treatment. You have to get after it. And when I say aggressive, it doesn't mean that it's going to be a hard treatment, but I mean we're on it right away, and we have a schedule, we have a plan, we're organized. And if it's something that we can't help, for example, a question comes up often, do I need to see the surgeon for this? And that person is making a decision not knowing whether they really need to see an orthopedic surgeon or not. But if they come to the Fukuri Medical and Chiropractic Center, they'll have a host of physicians to be able to help make that decision. Whether that's not necessary, we could take care of that problem here at a minimally invasive, safe approach, or no, we need to step it up 3 or 4 notches and direct you to the orthopedic surgeon. And it may not be the orthopedic surgeon, it may be a neurosurgeon that needs to be seen.
Yeah.
But whatever the scenario, we'll be able to direct that person to the best provider and do that very efficiently also.
The other day I was watching a video with the young girl. I don't know if you know her. She's a surfer, and she got bit by a shark, and she lost an arm.
Okay.
And she was saying in the interview that she still has pain in that arm, even though it's not there.
Yes.
You had mentioned something about phantom pain once before.
Yes.
But the question that wasn't answered in the video that I wondered about, if I have a pain in my leg, I might be tempted to rub it and try to massage it myself. As a doctor, how do you relieve pain when it's not there, when the arm is not there? I don't know if this is common or not, but...
Well, let's talk about phantom pain. It can be common. And phantom pain, the definition is when the limb is not there, you still feel the pain as if the limb is there.
Yeah.
And it is very frustrating. You can imagine psychologically how devastating that can be.
Yeah.
And a lot of our injured and disabled veterans that have had limbs that have been injured or amputated, they will experience phantom pain. For example, let's say a simpler case is that you have a pain in your toe, and they amputate the toe, and you still feel the pain in the toe, and you're hoping the pain would go away, but it's still there. Very frustrating. And the reason is that the mind doesn't realize that that limb is gone. It still thinks the limb is there. So the nerve ending, it's been cut off and disrupted, but the nerve still thinks it's extending all the way down to the fingertip and sending messages that the fingertip is causing pain. So how do we address phantom pain? It's a very complex scenario. Of course, counseling is very important. Yeah. Psychological counseling is very important. And on a physical point, what we can't do, there isn't a manipulation, a chiropractic manipulation, there isn't a massage for it, but sometimes through biofeedback, sometimes through equipment like a TENS unit, sometimes a spinal cord stimulator, those things will help to deactivate or lower the impulses of the nerve that's sending messages relating to the phantom pain.
Now, this didn't come up in the interview, but could I don't know if this is even appropriate, but could she take an aspirin or Tylenol or something like that? If it's not there, I can't see how the medicine would have helped. What is the answer to that?
There might be some relief with some medicines.
Really?
There might be a prescription medication that's calming to the nerve. If an inflammatory process is causing pressure on the nerve wherever it stops, but it's causing that inflammation is triggering the nerve pain, then reducing the inflammation may help with that. Let's talk about another disorder that could be very devastating also, RSD, or the newer name for it is CRIPS. And basically, the older terminology most people will be familiar with is reflex sympathetic dystrophy. And what it is let's say that there's an injury to your ankle. You're pushing the brake down, your ankle twists,
right.
And there's an injury to your ankle, or you're running and your ankle falls into a hole, or you have a fracture and it's put back together and pinned. Well, sometimes you have nerves that send the messages of pain back and forth,
right.
And you have blood vessels that wrap around those nerves, and sometimes you end up having a dysfunction or a poor function between the nerves and the blood supply, and they start feeding off of each other. So what will happen is, let's say it's in the arm, you fracture your wrist, and you end up getting RSD in the hand. It's a burning, deep, they call it causalgia. It's a very deep burning pain that's extremely uncomfortable, and it's a mixture of nerve pain and vascular pain also. So sometimes the coloration of the hand will change. It'll be a colder sensation in that hand, and it's very uncomfortable. And again, treating it is a problem. So another reason why, if there's a trauma, like we said, I truly believe that a lot of cases of fibromyalgia are chronic cases of non-treated injuries.
Right.
And then as the pain continues, the psychological component kicks in with it. But the RSD also, if you have a trauma to a joint or to an area and you don't get it treated properly, it could trigger off for no reason at all the RSD and have that deep pain that really there's no treatment for it. It's a very difficult.
Yeah, I would imagine.
Yeah, sometimes acupuncture helps, but only temporarily.
Yeah.
So another word of caution, that if there's some trauma, some injury, get to a place that's familiar with trauma. For example, we've been focusing 25 years specifically on trauma injury care, because if you can take care of those more complex problems, it's easy to take care of the other problems.
Right.
And get the proper diagnosis, get the proper care, so that way you have less residual problems in the future.
Dr. Fakhouri is waiting for your call. You are invited to make that call if you would like to speak to the doctor. The number is the WOCA Climate Control Source Hotline, 352-622-9622. And once he's off the air, then you can call him at his office at 351-3413. The holidays, again, present other challenges. We're weekend warriors, We're with the family, and you want to show Uncle Tom how you can throw the football, or how you can jump over a hurdle or something.
Or no,
like
Uncle
that.
Tom wants to show the nephew.
Yeah, maybe it's the other way around.
That's right.
Yeah, maybe it's the other way around. So there's an injury waiting to happen.
Well, during this time, we're doing more activity and under more stress during the holidays than normal times.
Yeah.
More people on the roads. There's more chances of something happening, some mishap happening. So, but the good news to that is that there is, care for those things that can help those scenarios. And so if Uncle Tom is throwing the football and he's feeling some pain in the shoulder, the first thing he should do is get some ice on it and give it a little bit of rest. If it persists 2-3 days, Uncle Tom should call, get into an office, get some therapy, maybe some ultrasound on it, some laser therapy, get some treatment to that area, and make sure that there isn't anything else, like maybe as he went down, maybe a vertebrae shifted, pull the rib out of position, and that's affecting how the shoulder works.
Yeah.
So getting evaluated properly to make sure the treatment, so that way the next year he can be bigger, better and stronger. next time he throws that football.
Next time he comes around.
That's right.
Any plans for your weekend?
Just family. We've got my brothers in from North Carolina, and children are coming in, so we're all having a nice family Thanksgiving meal tomorrow at Mom's house.
Oh, that's nice.
Mom and Dad are excited about that, so we're looking forward to the whole family coming together.
Dr. Fakhouri, thank you for what you do for all of us and for helping us understand our bodies a little bit better and for giving us a way to relieve ourselves of the pain that we might have. Again, Dr. Fakhouri's number is 352-351-3413. And what's the extension number?
The extension is 4, and 4 will take you to the front desk or to our patient care coordinator, Amy, and they'll be able to handle any questions that you have, whether it's insurance or scheduling, or if you have any special needs, or if you just have a question, just give it to the staff with your name and number, and I'll return the phone call.
And it's crazy out there. Be careful driving, but if the unexpected happens and you're injured, you might want to get it taken care of right away. Remember, the law has changed. If you wait more than 2 weeks, you're out of luck.
That's right. That's right.
Well, you have a great Thanksgiving.
Thank you. Next Wednesday, we'll talk a little bit more about that law and the implications on the individual that's in the car.
Yeah, very good. We'll take a break and be right back.
Thank you.
Do you wonder why you continue to experience pain? Is your daily routine affected by your body telling you that it hurts? Let us explain why this may be happening to you every Wednesday at 11 a.m. on the Head to Toe Care Show. This is Dr. Riyad Fakhouri, board-certified chiropractic orthopedist.